Hello, I'm Amy Boles. I'm a physical therapist with Memorial Health System. I've worked here for many years, and I'm very excited to talk about concussion today. A concussion is a mild traumatic brain injury that is sustained when the direct or indirect force contacts the head, neck, or body. Physical therapists manage post-concussion sequelae or results by a number of different methods. We work on head and neck pain, jaw pain if that's present. We work on imbalance. We work on dizziness or vertigo, and we work on deconditioning. We take people through a monitored exercise program to be sure they're going to be safe to return to activity. Yes, people say, oh, I just got my bell rung, but guess what? It's not mild. Over 90% of people don't have a loss of consciousness, but that does not mean you don't need treatment. Physical therapists are going to address the signs and symptoms that present even hours or days after the actual injury. We have to be very careful not to believe that mild means not serious. Mild simply means not life-threatening, but it's still quite significant. The vestibular system is the part of the body that tells us where we are in space. It helps us perceive where we are and then tells us how to move in response to that. With the vestibular system, there are crystals that are supposed to be in this area. Their official name is otoconia, but most people just call them crystals. With a bump to the head, these can get jarred out of place and go in one of these canals. These canals have fluid in them, and the fluid needs to move. When the crystals are in the canals, the fluid doesn't move, and then you feel dizzy and off balance. A vestibular-trained physical therapist will perform an assessment to identify if the crystals are out of place by doing different movement tests. Once we identify that they are out of place and locate which semicircular canal they are erroneously positioned in, we will do a maneuver to get them to go down out of the canal to remove dizziness and help with balance. Dizziness can come from the concussion itself, so we can work on the head and neck. We can work on the TMJ if needed. We actually have a board-certified temporomandibular and cervical therapist on our staff, so that will be very beneficial to people who have specific TMJ problems. But we're also going to be working balance. We're going to be working proper posture. We're going to be working on training people with the right specific positioning and exercises that are going to help them go forward in a more healthy way.
Hi, my name is Miranda Black, and I'm a speech-language pathologist with Memorial Health System's Therapy Services. I would also like to talk to you today about how our comprehensive therapy team can help get you back as soon as possible. Speech-language pathologists help to treat the cognitive communication deficits that can be caused by a concussion. These deficits can include difficulty with thinking, attention, memory, problem-solving, and language skills. Patients might experience any cognitive communication problems, which might include difficulty following directions or staying on task, difficulty remembering things from a day-to-day basis, difficulty with problem solving, feeling overwhelmed easily, difficulty with following instructions on a step-by-step basis, and struggling to multitask. Patients also might experience feeling slowed down or feeling like they're in a fog or taking longer to complete tasks that usually would not take that long. If symptoms last more than 7 to 10 days, or if it becomes harder to learn, think, or concentrate, it might be time to talk to your physician to see if you need a referral to speech therapy. Coaches, teachers, and parents can look out for changes in school and sports performance. Studies show executive function deficits, which can include planning, flexibility, inhibition, organization, and problem solving, are often affected post-concussion and can impact school and sports performance. It's also important to look out for slower response time, difficulty following instructions, changes in mood, focus, or grades, or forgetting plays, routines, or assignments. Individuals with a concussion are at high risk for development of second impact syndrome if you return to play before the brain is fully healed. The brain is injured and is in a vulnerable state. This can cause more serious injuries like swelling, herniation, or even death. Concussions are invisible injuries, but they affect how you think, talk, and learn. Speech therapists can help you to get your brain back in shape, just like physical therapists help to get your body back in shape.
Hi, my name is Rob Moat. I'm an occupational therapist with the Memorial Health System Therapy Services team. Because concussion affects brain processing and sensory symptoms, it's critical to treat it early to avoid prolonged recovery and secondary impact syndrome. Current guidelines recommend 24 to 48 hours of physical and cognitive rest, followed by a gradual return to physical activity based on symptom tolerance. Rather than extended rest, we use an active rehabilitation model that progresses light aerobic activity and visual and vestibular therapies as appropriate. Research shows that over 50% of concussed athletes develop visual symptoms like difficulty eye tracking, difficulty processing visual input. So integrating visual therapy can be essential. Vision therapy is a specialized rehab program that retrains the brain's control over eye movements and visual processing. After a concussion, athletes may struggle with eye teaming skills, quick eye movements, and tracking issues. This can lead to difficulties with reading, depth perception, balance, and even coordination with sports. Our team combines clinical expertise with a passion for helping athletes return to the activities that they love. We emphasize evidence-based protocols with advanced techniques like vision therapy, neuromuscular training, motion analysis, and return to play testing. With flexible hours, including early mornings, evenings, and Saturdays, we make care accessible to students, professionals, and athletes alike. So reach out. Our therapists are happy to help you return to whatever activity that you enjoy.
For more information about sports medicine and therapy services, visit our website at mhsystem.org.